Good afternoon, everybody. Good afternoon, everybody. Good afternoon, everybody. There is a great buzz in this room, and I feel like personally, first of all, my name is Ann Mosley. I'm a policy director here at the Aspen Institute, and I have the privilege to lead a program called Ascend here, and as well as try to help coordinate some of our many policy efforts here. And I, probably like many of you, am both thrilled that it's the last day of January. I feel like in this month of 2014, the start, I've had 9 lives in 1 month. And you know, for all of us who are really thinking and share a passion about how are we sort of keeping the American dream alive for everybody, this has been sort of an extraordinary moment in our time. And for me, a couple thoughts I wanted to share was I'm sort of someone who very much likes to look backward before I look forward. And I'm a big appreciator of history. And so I took really seriously as we were approaching the 50-year anniversary on the war on poverty. Like many of you in this room, what have we learned? What have we not? And one of the things that Ascend at the Aspen Institute was really excited to be a part of was the Shriver report that Maria Shriver led that was really taking a look at the war on poverty through the lives of women. And many of us in this room know about so many women who are sort of living on the brink, mothers holding it together. And it was, we were asked to write a chapter that was really looking at personal solutions and collective impact. And so for our work, to really thinking about the voices of families, the voices of the next generation of kids, and to think about the context, we focused the chapter in the Shriver report specifically looking at the opportunities and the promises of 2-generation approaches, of social capital, and thinking about how are we doing life education in a way that is really 21st century. How are we passing on what one generation knows to the next? It was something when I stood back and sort of thought about what were some of the takeaways around the war on poverty. Just a few thoughts. I mean, it was incredible. The night before the release, I had dinner with the Shriver family. And to sort of talk through some of the stories of what Eunice and Sergeant Shriver talked about when they were creating the Office of Economic Opportunity and when they were creating incredible programs like Head Start. That Eunice Shriver and Sergeant Shriver sat at that table thinking about the value of investing in early, the importance of thinking bold. And so when we think about where we are now going forward in the President's State of the Union, we think about how he called out sort of addressing poverty and inequality as our sort of defining issues. How do we think about that boldness, even if we think about the first summer of Head Start, where they originally thought they'd have 25,000 kids in an 8-week summer program, but they actually enrolled 560,000. And I think here at the Aspen Institute, we're very interested in being a little bit bolder. And hopefully some of this conversation will be a little bit of inspiration for you all in what you're doing. So thank you for coming. Today we're really going to focus our conversation on a new publication we just put out today called Gateways to 2 Generations. And a few comments I'd like to share about that is sort of why we did it and what we hope to sort of take a look at and then talk about the people who made it happen. So first, why? For many of us looking at the issues, if our ultimate goal that brings us together as a North Star is how are we building family economic security for all, we really wanted to build on what works. We all in this room know the importance of early education, and we can all cite the return on investment, good work, early learning environment, in field, leaders. We all know that post-secondary makes a huge difference in what our sort of family security and the impact it can also have on the next generation. We all know just a little bit of more income for a family of $25,000, even $3,000 extra can have a profound impact on the family's current and 17% return for the young person's adult earnings down the road. So we've learned a lot about what's working in education, be it post-secondary or early. We know about the importance of income supports. We know about the importance of social capital, health and well-being, but we haven't knitted this yet together. We haven't brought this together through the lens of families and systems. So when we went to do this report, we wanted to look at it 3 kind of big things. One was, if we look at early childhood as probably one of the strongest places to start, where was the promise and potential to think about how to work more deliberately with children and parents together? So we wanted to make sure we look back before we look forward. So in the back of the report, you'll see an appendix that kind of lists out some of the milestone moments. I'm sure it's not fully complete to the people who were part of creating this milestones happening. It was meant to be what you can put into one report and sort of a chance to get a primer, if you will. We want to be clear that we set out what's the context. You know, right now we're at a place for the first time across generations, we don't believe it's going to be better for the next gen. That's a crisis. We know that the economic social mobility promise is not what it used to be. You know, you can't just get a good education and get a job and expect it's going to work out. So we need to think about that. Shifting demographics, different budget environments. So we tried to lay out a clear context. And then we really tried to be provocative, thinking about old and new think. One of the things that, and Rachel and Joan and Nisha and myself who did some of the working groups, we realized one thing is no one wants to be an old thing. And no one really is an old thing. We wanted to push a paradigm that could help produce some new conversations. So we thought about old and new think. Then we really wanted to go through the core components of where we were seeing a two-generation approach through an early childhood lens and lace it with what do we know in terms of some of the research and where are some of the promising programs in innovation. And then lay out where are some emerging sort of practice and policy implications and potential sort of next steps or conversations. So that's what we set out to do. That's what we shared with you all today, and that's going to be our conversation. So how do we do this? So as many of you know, sort of Ascend was created in partnership with many great foundation philanthropic partnerships. I'm delighted to see Siobhan Davenport from the Rock Springs Foundation. Thank you, Siobhan, for your early support. We're delighted to have the Annie Casey Foundation, who's been a leader in their field and to be a partner with us, as well as Kellogg and many others. So building from the base, one of the first things we did when a certain leader that many of you know, Dr. Joan Lombardi, who has served in leading positions both with the Clinton and the Obama administration, and she really has been an early childhood expert both at the national and global level, was when she was sort of stepping down from government service, was to ask her to come and work with us as an advisor and as a consultant to help flesh out where was the promise and potential around early childhood. Brought Joan here. Joan immediately said, let's bring Rachel Schumacher in. So I also want to thank Rachel Schumacher and Joan Lombardi for joining the Ascend team for their work to help make sure this publication came together with their vision, their research, and their writing, so thank you. I also want to thank my colleagues Nisha Patel and Jennifer Stedron, who also partnered closely with Joan and Rachel to really lay out the framing, the research, and the models. It was a very collective effort. I also want to say a couple things when we did this. This was something that has been a conversation tool with the field. Some of you we had asked to be peer reviewers. We are really thrilled. Mira Mani, who's not in this room, but she's a program director at the Packard Foundation, hosted a forum with us on early childhood innovations, of which this was a major discussion, to use it as a way to have a conversation. We had many peer reviewers from Lindsay Chase Lansdale to also Stephen Dow and Rick Noriega, who are here with us on the panel, as they are also featured as innovators in the report. So I share that because what I'd like to sort of underscore is the nature of this is sort of reflective of many people's hard work and insights. And one of the things that I was just saying to someone yesterday, whenever you're trying to do anything of sort of meaning, there's usually many footprints and many fingerprints. And so I could go on talking about all the important people that helped contribute to this, but I think what was also really the spirit of this was meant to be a spark for a new conversation, bringing people together, building on what works, trying to connect the dots more effectively, and pushing for innovation where we're not yet seeing it happening. So with all that said, I'm going to sort of turn the car keys over to Bridget Schulte, who is a fantastic reporter at the Washington Post. Bridget is, she's someone who thinks about these issues. Her two areas of sort of expertise, and I would also say some passion, is really thinking about work-life and poverty. And I think those are really two to put those together. She's working on a book that's going to be coming out in March that's titled Overwhelmed: Love, Work, and Play, and Who Has Time? I think that sort of relates to all of it. But Bridget is someone who tracks these issues, whether she is up at 5 o'clock in the morning at a homeless shelter to talk to the people that, because funding got cut, they're not getting, they don't have a home. But she's out there literally bringing new meaning to what it means to be a beat reporter, as well as to really be someone who is a thought leader and how are we thinking about what are new ways to kind of process the life that we're living. So she's going to be leading the panel, but I just want to do one sort of less set of shout-outs. Rick Noriega, who is the president and CEO of Avance. Avance, as we all know, is doing incredible work connecting with families across the United States. They just had some recent research that they, I'm sure you'll be sharing with us about some of your success and your learning and growth, and we are just thrilled to be working with you. Rick, as well as being passionate about early childhood and a leading CEO, also has served in the state legislature in the great state of Texas. And so he brings a political perspective to what does it take to go to the next level. Dr. Joan Lombardi, who really needs no introduction. We all know her as an international and national expert. Not only has she served presidents, probably everybody's different foundations, mentored half of the people in the room, including me. But Joan is, I don't think there's a title that would capture her passion or her experience. Stephen Dow, who is a phenomenal leader, who gets a medal for making it in from Oklahoma. I think anybody who gets on a plane with this crazy weather is a bold person. But Stephen has been leading the CAP Tulsa work, which I know many of us have been tracking across the country, not only through the stellar work they've done to think about how do they do sort of best of class early childhood in many different ways, but to then do some cutting edge work around career advance and really having some concrete models that are looking at children and parent success together. Stephen also, when he came to CAP Tulsa, I just think this is amazing because we've all been in the trenches. It was sort of 2 staff people and probably a budget of less than 200,000, and now it's more than 53 million, maybe more. So this is the man who can also work at the ground level and build and think scale, which is, I think, scale is a big challenge for a lot of us here. And then lastly, I'd like to introduce Susan Gewirtz, who is a senior program associate at the Casey Foundation. Many of you probably know Susan. Susan has been a core part of the community and economic opportunity team there. She's been a partner with Ascend for over the years, and many other ways to you folks in the room. So the Casey Foundation has done great work in this area. So we thank you for your personal and also your institutional support for the field and also with Ascend. That said, car keys to you, Bridget. Thank you to each of you for making the time to be here.
All right. Well, great. Well, thanks everybody for being here. Let's we'll just jump right in. Anne was talking about, we've had 50 years now, war on poverty. There's been an awful lot of discussion, national debate about what worked, what didn't, how far we've come or how far we didn't. Elderly poverty dropped dramatically, but still quite a bit of child poverty, single parent families on the rise. Joan, you were there, I wouldn't say right at the beginning, but you've been in the trenches for a long time. Reflect, if the goal here today is to figure out kind of what's next for the next 50 years, talk about what we've learned, what works, what doesn't, where do we go?
Well, first of all, thank you so much, and thank you for your incredible work on behalf of all the women that you write about and the families. And I feel a little bit overwhelmed myself. I'm just delighted to be here with people like Lee Shore, who really was at the beginning, and Dr. Linda Randolph, the original pediatrician, one of the pediatricians in Head Start. So it's a really exciting moment. When you reflect back on the original founders of Head Start, and one of the things we did early on was read the original Cook memo, and if you read that memo, you realize the pioneering recognition of the importance of families in the life of children and the education of children. And I think what we're seeing now is really a renaissance of that idea, with more evidence, with more different contexts, and I would say with new opportunities. And just to talk a little bit about each of those, the scientific evidence has just been mounting since that time. It's very clear that families play the central role in a children's education, and that the context of their lives, their income, their own education matters to that child development. I think we also know now that that there's more need for this now than there ever was. We've got families that live hundreds of miles away from each other. We've got a changing demographic with single mothers. We've got disconnections, and this is about connections. And we also have new opportunities. I think, to me, childcare has always been the new neighborhood. It's the place where families can come together, so it provides us the kind of opportunities. So some things are the same as they were, the same concepts, but I think they're in a new context.
Okay, that's great. Stephen, let's go to you and let's talk about. You came at these issues from not so much the early childhood side, but from the workforce side. Talk about what we've learned from that approach, where we've taken that and where to go with it.
Sure. So when our agency really was originally founded through a grant from the Office of Economic Opportunity as a program to help migrant farm workers in an area just outside of Tulsa. And so through much of the organization's original history, we really focused on working with adults. And over the course of the time that I've been working and have been the director of the agency, we really focused most of our efforts in the earlier years on adult services. We were one of the first organizations to really do community-based income tax work when we were trying to help people access the Earned Income Tax Credit. We were the large-scale random assignment site for individual development accounts and have done a lot of work in asset building. We've done a lot of affordable housing development. And the more efforts that we made trying to focus on adults and thinking about what kind of impact we were having, the more clear it became to us from a practitioner standpoint about how compelling it was to start earlier. And so we then had the opportunity to become the Head Start grantee in the late 1990s and really began doing much more early childhood work in addition to the work that we were doing with adults. And then in 2005, as an organization, we were going through a big strategic planning effort, and the consultant with whom we were working challenged us to think about how we could triple the impact that we were having as an organization within a 3-year period. And it was really that moment of really trying to challenge ourselves to dramatically increase our impact when we really thought about how we could braid and knit together the work we were doing with adults in a much more strategic and impactful way as we did with kids. The way that I've sort of described it to some of our internal team is, and I pulled up on YouTube the old commercials for those of us that remember the old Reese's peanut butter cups, right? Two great tastes that taste great together. And that sort of those great visuals of the guy with the peanut butter crashing into the people with the candy bar and then their discovery. And that's sort of what we've been thinking about. How can we take what we've learned about early childhood and the advances that we've done with what we've also learned over the course of the 5 decades working with adults? And there's a lot to learn in both areas. And so what we were thinking about is how could we really combine those two things together and whether or not the combined effect would operate at the household level in ways that neither just focusing on adults or just focusing on kids achieved on its own.
All right, great. And I want all of you to feel free to jump in and comment and back and forth. Rick, let's go to you. Talk about first 2 things. First of all, talk about your program. You've just got some new research that's come out. Share that with everybody. Talk about what it does, how it works. What you've learned over time in terms of combining these 2 efforts or single efforts. And then secondly, I want you to talk about the political climate. We mentioned that a little earlier. We've had some discussions about, when we look at the political climate, these programs are expensive, some of them. How can we afford this? Do we continue throwing money at these programs? Are there other strategies? Talk about building coalitions, bipartisanship, and the political climate that you face.
How much time do we have?
He's from Texas.
Yeah. So let me first begin, Ann, thank you for that wonderful introduction. And to be here with this group here is quite humbling for an organization like ourselves, who for 40 years have been toiling in the fields that grew out of 2 graduate students that studied under Yuri Brofenbrenner and brought, with a small grant 40 years ago, developed and began executing or implementing a 2-generation intervention. And that is what's been the core program, the parent-child education program of Avance for the past 40 years. As Ann was speaking, I was reminded, if you have the chance, another great YouTube, Steve, is a please look up LBJ Cotulla, Texas. In the mid-1960s, a guy from Texas brings Congress in for a joint meeting out of the State of the Union cycle. And he talks to them about being a school teacher in Cotulla, Texas, where he had to teach barefooted children, primarily Mexican-American children who did not speak English, and he didn't speak much Spanish. And he always thought that as a teacher, what he could do was perhaps just give them a little bit of hope so that the next generation might have it just a little bit better than what they have it. And he never envisioned that he would ever be in a position to make a difference in the lives of all those children or children like them across the country. And then he says, and he looks into the camera, he says, but now I do have that power, and I'm going to do something about it. And that was the commitment from LBJ 50 years ago in the War on Poverty. And so I think programs like Avance evolved from that spirit. And I parachuted into this particular role after having been in the policy side and having been an operator on the military side. And I come at it with a particular lens of understanding what the decisive point is for our country and our community moving forward. And as I was sharing with Joan and Steve earlier, at the tactical level where we're growing and administering programs, Avance will continue to grow and we'll serve another, and as Stephen was talking about, marginal numbers of children and families that really do qualify and need the kind of intervention that we deliver, and a lot of other organizations do too. And the facts are clear. If you'll please pick up a little flyer we have in the back from IDRA, a study that was done over the course of this past year, interviewing a whole host of Avance mothers and children from 1999 to 2006 and where they are today. And what it demonstrates is what we know. The attrition rate of their children is far less than the state or the national average, especially for Latino children. The mothers have better employment, or more of them are homeowners. And all of those social data points that we all look to as symptoms of poverty oftentimes are addressed. What then becomes challenging, I think, for not just organizations like ours is the reality that even if we had all the money in the world, you're not going to be able to perhaps scale and reach everybody that really needs it in this country to continue to be competitive both locally or internationally. And so what we then have to do, and I am so honored and proud of what the Ascend Project is doing to be the hub of the two-generation voice and of great work and of research, etc., is how you fill the delta, how you fill the gaps on all of this work that's occurring, the different flows of money, all these hodgepodge patchwork of great work that may be occurring, like in the case of San Antonio that took the local effort to see how they were going to do pre-K for students there in San Antonio with a direct effort on its citizens, or in how in states like in Oklahoma that have done things that are innovative. And you see the states in the other states in the South, quite frankly, that are red states, that are some of the more innovative states. Or how what Massachusetts just announced a few days ago on the Pay for Success and the social impact bonding. How do we then synchronize these collective efforts, both in federal policy and in state efforts and in local efforts, so that we maximize those efforts so that more children and families get served, so we can continue to see the results as demonstrated with the flyer that I have from the IDRA study that was done just last week.
Okay, we'll come back to some more political culture, and I want each of you, I'll ask each of you to reflect on the specifics of actually what your programs do, or Joan, if there's certain, and Susan, if there's certain things that really have struck you. But let me turn it over to you, Susan. Rick talks about decisive points. What have you learned? What has the Annie Casey Foundation learned are some of the decisive points, either in early childhood or workforce development, in really moving families, giving them that social mobility to move from poverty into the middle class? those rungs that President Obama said are pretty steep and wide and rickety.
Sure. So the Casey Foundation is a kids foundation, and I work in the Family Economic Opportunity Center. And it's been a learning experience for us, around the two-generation process. And I think we're very focused right now on some of the things that Stephen has said, that how do you bring these together? And from our perspective, it's also about how do we work with organizations around the country to develop evidence around this work? And what are those points at which people are able to move forward? And it really differs. I think there's a lot of work. We just had a terrific meeting with 4 sites that we're working with, Stephen's organization being one of them. And talked a lot about trying to understand sort of the different skill levels that people are starting at, and understanding then what the trajectories are like given where they're starting. And I think one of the things that really struck me from that meeting was around future orientation. And we may feel really clear that we know where people should be headed and sort of what family's economic success or financial stability looks like. But the family has to believe it, and they have to believe that they can do it. And what do we do as we design programs or look for policy solutions to encourage those families to see their futures in a different way and to build kind of some of the small steps that over time will lead to where they want to go and the investments they want to make in their children.
So what I'd like to do, I'm watching the clock, if I could go back to you, Joan, and kind of go through, and each of you talk about a specific program or a specific leverage point that you have found inspiring, potentially hopeful, and then I'm going to go back and ask about what some of the barriers or obstacles for implementing some of those programs, and if there are other approaches that that are out there that might be competing. So
well,
Joan.
I mean, there were so many examples that we saw and wrote about in the report. I remember going to one of the teen pregnancy prevention programs in Vermont and talking to the young women, and really what that I took from that is exactly what you just said. They gained a sense of their own future and the possibilities of their own future. I saw the same thing on the other side of the country in Magnolia Place in LA, where they brought all the services together and they were going block by block, reaching out to families and encouraging that kind of future thing. So I think it's that potential. We're at a very interesting moment in the history of early childhood. We've got enormous attention. Now I think there's 2 challenges. One, what is the service going to look like that we're all going to deliver? And back in '65, we thought we could end poverty with an 8-week program. I think now we know, optimistic people. I think now we know that it takes a pathway of services, from prenatal care to through the early years, and that's the pathway that we need to keep in front of us. That's what we're aiming for. The family is the continuity across that pathway. And so they have to be involved every step of the way, including in the primary grades, which we really need to talk more about. But to get there, we need a financing strategy. We've got a lot of attention now, but we need a significant financing strategy to be able to make that pathway a reality at the federal level, at the state level. And I think really the innovation that's going on is at the community level. When we started this process and started talking about linking adult services with early childhood programs, some of the comments were, well, the programs were already overwhelmed, don't add another thing. And we heard that message loud and clear, but this is really about partnerships. It's not about one individual program being able to do that. When I think about places like Palm Beach County, where they're pulling all the services together, we have a lot to learn about federal policy from what's going on in communities.
Okay. Stephen?
Well, I think the report mentions the real tension that's existed in terms of our not being sure whether the work we're doing as a national policy with young kids is in order to be able to facilitate people going to work, or to really think about educating kids at a younger age as the principal goal. We as an early childhood education organization were very much focused on thinking about the educational goal first and foremost. And as we then tried to figure out how to bring a set of programs and supports to allow parents to further their own education so that they could then get in jobs that were in demand in the community. The design team that was led by Chris King and his colleagues at the University of Texas at the Ray Marshall Center focused on a sector-based workforce development effort and selected the healthcare sector as the sector that we wanted to start with. What we've come to discover is just how difficult it is to move adults who are at the skill level that most of the adults that are the parents of our kids enter the program at through in a way that allows them to get to the requisite degree of skills that they need to then get into the jobs that pay the kind of wages that will allow them to be self-supporting. So the sort of paradox for us is the very reason we're in the early childhood business is because we know how critical those early years are towards later success. And yet we're now trying to say, how can we be successful with the adults? And the reality is that we don't have enough time during the time that their kids are in our program. And the length of time that we thought it would take for parents to get through this skill development program is we often underestimated it. We underestimated what kind of resources it was going to take. We underestimated what the impact would be on their own stress level as they were trying to enter a very challenging new program, the demands that it placed at the time their kids are very young, and quite frankly, the downward economic pressure that it put as they leave the workforce in order to go and invest in their own longer-term future by building a better set of skills. So I don't think that we've really figured out how to array the public policies so that those people who are motivated to go and try to improve their own conditions can really be supported with all of the ways that they need to be supported in order to make this kind of effort really come into reality.
It's fascinating. Susan, did you want to add?
Yeah, I just wanted to build a little bit upon the issue of stress and family stress and the young child. In the report, you mentioned, I think, probably both stress, I think probably toxic stress at some point in there. And one of the things that we've puzzled over is sort of what's the right outcome for, I mean, if we were just doing workforce, which we've done, you would talk about this sort of, job readiness, get into a sector program, earn $4,000 or $5,000 more a year, right? That sort of that kind of thing. But when the family has a baby, is getting into a stressful workforce strategy the most effective thing to do right then? Or, also in the report, you mentioned sort of that $3,000 or $3,000, that can make a big difference. So maybe that's a policy issue. So how do you blend all these different priorities that we have? Work is good, and I think we would all agree with that. More money in the family is good when the child is very young, seems to be important from the research. And how, as from a programmatic perspective, how do you put that together in a way that works in the policy context and works for the family and is realistic given today's current labor market? So it's balancing those types of things. And you're the ones who actually have to face it every day.
Well, I don't think we're choosing
Yeah.
raising income or programs. I mean, I think the vision of the 2-Gen framework is that we want to put that together, because for me, the outcome is a healthy child, a successful child, and that child can't get there unless the family is thriving itself. So you get the benefit of the family thriving, or you don't get the healthy child development. I mean, so that's the kind of goal that I keep in front of me as a child development person.
One of the things that the researchers found really surprising as a result of the interviews that were conducted with the Avance graduates and children was how well the children were doing, one. But let me just back up real quick, because you were asking about the program. What Avance has implemented has been a 9-month, 3-hour a week, followed with a 1 hour a month, a home visitation, typically center-based or school-based, aligned school-based, pre-test, post-test, large graduation at the end of both the toddler, infant, and mom, and you would think that they were graduating from Stanford or Harvard, with mariachis and auditoriums filled with family. It is a very important an important event. Nonetheless, was that the parents said that the skill sets that they learned within our circular model was that it really helped keep the family together for the purposes of addressing the challenges that they were confronted with, whether it was issues of finance, whether it was issues of just communicating with one another in a manner that they had not learned before. And so that what the intervention actually did was really help the family meet all those challenges in a way that they had not expected. This was the researchers' report of what they got out of these interviews. And I think that these other effects occur as collateral effects by really shoring up that family unity, and then these other good things happen. So you know, I in looking at the report as well, and the kinds of families that Steve and I were talking about and who we serve, and where we're going to see by the year 2050, 30% of the population predominantly is going to be our Latino families. And we also recognize that the trend line of all the social indicators and demographics and whatnot are continuing on a downward spiral. This has to be, we have to collectively have a sense of urgency as a nation now to do something about it. We have to. We can't keep talking about it. We have to do something about it. And we have to, and that's why I'm so glad of the work of Ascend, is to help in that coordination of efforts for the intervention, because I think our national future depends on it.
I'm going to come back to that point and ask you a little bit more about that. But you know, Susan, did you want to add, you know, something from the report that you found particularly, or from you know, some of the pilot programs, or some of the things happening across the country that is particularly hopeful or promising or inspiring?
I think there are two things in the report that emerged for me. One, again, is sort of related to kind of this future orientation, and it was the CFED Child Savings Program. And I mean, I've seen research about, you know, having a savings account in a child's name is such an important predictor of whether that child will move on and on that pathway. And you know, whether it's thinking about the parent who's on that track, or whether it's the child who's on that track, or whether they're both on that track, but always moving, it's right, you sort of, again, sort of this balancing of the current, you know, what does the family need right now, and helping them to see where they can be going into the future. So I think programs like the CFED one are very important.
I mean, one of the most exciting things at the beginning of the Obama administration that we launched was it was the period during the recovery. People were really struggling. So we created this program called Assets, which tried to promote financial literacy in early childhood programs, in Head Start, in child care. And it might have been a small step, but it was an important step to bring these pieces together. One of the things I wanted to add to this conversation, though, is something that I see that's different now than over the years is we've got new methodologies about working with families, and I think that, you know, Avance and Stephen's programs kind of exemplify that. The goal is not parent involvement in the program. The goal is the parents' involvement with their children. And I think that vision is finally really getting through, and however you can do that. It struck me when you gave us that image of the mariachi and the happiness. They were happy about their children's success, which was their success. That's really the goal.
And it also then, it's the pebble in the pond, because then you've had an intervention with the family, and we see it in the schools, in the community. It then becomes an intervention in community and community engagement with our parents. And you know, we've been fortunate enough because we have had, over the past 40 years, you know, friends like Casey and Kellogg and whatnot that have allowed us to do this work. And I think we're now at the tactical level looking at how, you know, still for the next 40 years, what is that going to look like in terms of evolving, in terms of time, intensity, dosage, delivery systems to achieve the same effects, at the operational level of how we continue to look at serving more families and children. But really my role here now at the strategic level is how we have this conversation so that more families and children are served to receive the intervention for the future of this country.
So let me ask all of you at this point, and then we're going to open it up for questions. You know, Joan, you talked about requiring a new financing strategy. Rick, you talked about a sense of urgency. You know, Stephen, you've talked about we don't have the keys quite yet. We're still figuring out from, you know, and Susan, you talked about from a policy standpoint. Where do we go? What is next? How do you get political will, buy-in, and how do you get this financing strategy?
Well, I mean, I think the system is really strained more than people realize. I mean, the other adult in the child's life is the child care and early childhood worker who, you know, if you look at their wages and their working conditions are not the ideal conditions that we're talking about for families that affect child development. So that's the other adult that we have to think about. And you know, the situation now is that families are paying a lot of money for these services and providers are not getting the salaries. So you've got this imbalance. We need a third-party payment system. 75 years ago, more than 75 years ago, we made a commitment as a country to our elderly, and we need that same kind of commitment for very young children. And that's the image that we have to keep in front of us. We have to have high expectations. You know, people say the programs are costly. No, they're not costly. What's costly is not doing the programs. And they're an investment, and we have to switch that vision around. And I really do hope that we have a conversation over the next, you know, 5 years, 6 years, or however long it takes. I'm getting more impatient as I get.
Well,
I'm now Medicare eligible.
And I would agree with Joan and her vision of that. And I think that certainly other countries have made that commitment, whether it's India or China or Israel, that have made that commitment and early learning. And I hope we eventually get to that point. In the meantime, I think there are efficiencies based on policy, and Joan would know better than anybody how critical shall versus may in language can be. And to the degree I will share with you that in our cases of Avance over the past 40 years, and Joan was one of the pioneers in really helping to break down these walls. You had these silos. We functioned in these two particular silos, whether you were in the education silo or whether you were in the health and human services silo. And finally having those entities cross-talk and you know, education begins at 6 or 5 or whatever the case might have been at the time, and really understanding the continuum. So even just within the educational silo right now, we've found that in innovative ways, let's just take Title I for instance, that has a parental component. We still find schools and superintendents that will just have a big pachanga and feed a box lunch, and that's your parental engagement. And there are smarter ways of exercising those kinds of funds. And even with English are rather bilingual ed and other kinds of things, there are ways that there are efficiencies to be realized right now within current dollars. And language is critical. And while we have certainly an administration that is very much forward-looking in this conversation, those things can be done within agencies without statute, which you aren't going to see any statutes probably passed, right? So, you need to do it while you got the pen in the hand.
Stephen, Susan?
Well, I think that there's reason to be encouraged with the kind of attention that's being called to whether or not individual systems are working well on their own right. So, the president's called just this week about really looking at the federal government's workforce training efforts, the emphasis on college affordability and access. Each of those things is an important component, but if the folks in higher ed are just thinking about producing more college graduates and not thinking about what's the impact of that on a family with young children, and the workforce folks are just thinking about training people for better jobs but not mindful of what needs to be happening for their kids at the time that they're being trained for better jobs, I think that we run the risk of just reinforcing the silos that we've built. And I think that sort of the kind of work that I think one can see going on at the community level is when we sit down as the Head Start and Early Head Start provider with our colleagues who are doing adult education and workforce development training and really try to work through the details of, if our goal is to be successful for this family, what does each of us need to be prepared to do differently than we're currently doing when we're just focused on our own goal? And I think that that's really the moment that I hope that we're at as a country right now.
That's the crux, that image of those agencies coming together. I was in Massachusetts, and it's happening in Colorado, where they're bringing the adult-serving agencies together with the child-serving agencies and talking about the fact that the adult-serving agencies are serving parents and what that means, what it means to have the child support agency talk to the school, because they're related. They're all serving the family. So I think something's breaking through, and that's the hope of the Ascend framework, I think.
Absolutely. As an example, we were just entering into the MOU with the Far San Juan Alamo School District in South Texas, which is in the Rio Grande Valley, just outside of McAllen. And Dr. King, the superintendent, has committed a school building that we will operate with 18 other partners, everything from ESL, computer literacy, all the way to include the Valley Symphony. So it's a consortium of that circular model, all with our parent-child education program, Early Head Start, and the continuum for adult ed. That model is not anything new, but when you have very forward-looking superintendents that say, okay, I'm going to really invest in the feeder pattern of the kids that I'm going to be receiving long-term for success, I think is a model that is worth looking at for replication.
And Susan, we'll leave it to
it
last
seems
comments.
like we're at a really important bubbling up time right now. I mean, as we look around the country, and there's so many places, whether it's at the state level or at the community level, really trying to figure out how to do that. I mean, I wish we were at the point where we need to be sort of at the highest level, where it's sort of that moral imperative that every child, every family should do well. But I think some of the work that Ascend is trying to do around sort of the public will building and political will building is very important. One of the things that I guess two things I'd say we're kind of interested in sort of in trying to kind of move the field forward would be supporting organizations around the country who I think are just so much wanting to do the right thing, sometimes within their own organization or with those important partnerships, or trying to figure out how to work with their state partners or county partners to make it work. And I think that's sort of at the practice level that's important. One of the things that we're investing in through at the moment with 7 different places around the country or organizations is sort of what does it take to do this, and try to document that as sort of a first step in being able to say what are the types of models that seem to show more promise, and then eventually sort of trying to make that case as, again, as sort of part of the public will building around this. But I think it's sort of working at both ends at the same time.
All right, well, this has been fascinating. At this point, we'll open it up for questions, so please feel free to ask of anybody anything you'd like. Yeah.
I love. Yeah, Mary Vogel.
Yeah, please identify yourself.
Who does a lot of collective impact planning in the D.C. metropolitan area, primarily Fairfax County, but very involved with the D.C. Promise Neighborhood Initiative for its planning and early launch. And I've worked a lot with Joan over the years. After this series. You know, I want to get back to Susan's question and comment about the most important outcome, and love how Joan focused us that it's not just about parent involvement in programs, it's about parent involvement with children. So this might end up being controversial. But I'm remembering all the upset when the consultant, whose name I'm forgetting probably mercifully for her, said, you know, Ann Romney had never worked a day in her life, and everybody said, oh my God, mothering's a job. The Obamas, everybody came out. And I wonder, especially given everything we know about the infant-toddler period, and the fact that in 1975, 5% of children lived in deep poverty, and now closing in on 10%. And we know about cash being so important to reducing family stress, and the Cherokee Nation study just came out, and Brown's done the study on mothers' pensions.
Right.
Why wouldn't we say that mothering, parenting, including the father too, but I think that's why it's controversial, because there's single women in poverty don't always have the father as available. Why wouldn't we say that parenting is the job and pay for it from 0 to 3 and call that 2 generations right there?
Who wants to take that one?
Yeah. I mean, Mary, I think it's a really important point, and particularly for, you know, low-income women who have no options. You know, we've all met so many women who have to go back to work, you know, 2 weeks after they have a baby. There are no options.
Oh, God.
And I think paid leave has to be part of the agenda. Paid leave. Paid leave.
And no state pays a TANF benefit over 50% of poverty anymore. So imagine the opt-in, opt-out choice for deeply poor women. And then you have 1.5 million women disconnected from jobs and TANF in this country. I mean, when you look at all that, you wonder how we're going to win it unless we say cash is part of the deal.
You know,
Cash is part of the deal.
yeah,
You're not getting any argument, I don't think. And I certainly understand what the template or the profile of that growing number of women look like.
Yeah.
I mean, a lot of the other countries around the world are investing in income supports, in conditional cash transfers that are now linking with parenting programs. I mean, those are options that we should be looking at. We should have a new dialogue about this and not be afraid to have it, because somehow we won't be supporting personal responsibility. We need to have this discussion again.
you know, I just would add a couple points to that. It was very interesting. I was writing a story about asthma and poverty, and I was over at Children's Medical Center, and I was talking to some of the mothers there with their kids and who were having, you know, in the ER, and I talked to this one woman, and you know, kind of your usual basic kind of who are you sort of questions, and I said, and you know, what do you do? And she said, I'm a stay-at-home mom, and I said, oh, really? And she said, yeah, I'm on TANF. And I just thought that was such an interesting interesting perspective, because in this country we so value the stay-at-home mom, and there's a lot of cultural pressure for those who can afford it, that's the right thing to do, and yet for for women in that lower income kind of pool, that's so stigmatized. That's not the right thing to do. I just thought that was such an interesting flashpoint of our culture, just right there in the ER. Okay, next question.
Great. My name's Tommy. I'm with the National Head Start Association, and pleasure to have this type of a conversation. I think on a Friday afternoon is perfect for something like this, especially after the State of the Union. I know it's been very exciting. So I just had a quick kind of caution, and then really a question. And this comes from Ann. I know you were at our conference earlier this week, and a parent raised, while we were having this conversation, a parent from Philadelphia stood up and said in front of the whole group, one of her concerns about taking a look at an approach like this is that we're talking about post-secondary education, we're talking about kind of social or building assets and things like that. A lot of the families, and again, Vance and Cap, you know this, a lot of families aren't at that point yet. And we have teen mothers, we have other folks who have all these other kind of needs that we need to make sure we're addressing first. And a lot of that is what Head Start and Early Head Start does through, as kind of the intervention that's been doing that. So I just want to put that as a caution that this is, great where we're going. We need to be mindful of where families are first, and make sure we're helping kind of stabilize as we try to do first, and then kind of grow. Because again, it's fascinating the work that you all and a lot of our other colleagues in Head Start and Early Head Start have been able to do. Now, the quick question, and this is kind of stemming from at the beginning, we were talking about we need to go bold, and we need to do something big. And I think that kind of from a Head Start perspective, we've been doing the two-generational model for 50 years, 49 years to be exact. And I think for early childhood, this is building on something that you said, Stephen, is that it's not enough time, birth to 5. When we get families in, help with them, kind of stabilize some of these things, and then figure out where do we go from there. And I just would ask or open up a question is, what do we do beyond age 5? How can we ensure that this multi-generational model, which we know works and we know is so effective, how can we expand that into K-12, into these other things? And again, you talked about some of the things going on in the Rio Grande, but it seems like there's such an opportunity there that hasn't even been begun to be discussed, and we've been starting to have this conversation. So again, thank you, and I applaud all the work that you're doing. This is a fantastic conversation to have, but just would see if we can be bolder.
Well, I think it's it's a great question, because all of us that are working in this field, there's two things that are primary drivers. One is proof, and two is quality. That especially for our donors and whatnot, to be able to demonstrate that. This last this report that we published last week, trying to locate, for them doing the phone interviews and trying to locate families in a highly mobile group is expensive. It's tough. That's why we have found, when we have been able to build those relationships and trust with school districts, and when we have that, we're embedded within the schools, we're much better able then to have that continuity for the purposes of research, for the purposes of tracking. And in fact, in Dallas, we had our quinceañera, 15-year anniversary in Dallas, and so we could tell you the educational or the professional development of the parent and where the child was, and we had that relationship with the school district having a tremendous amount of data. But I think absent that, oftentimes it's very difficult to build that continuum for the purposes of knowledge, and I think that's critical. Again, I mentioned earlier, of breaking down those barriers between agencies. But at some point, we really need to better be able to do that, or find a technological way, because I will tell you, regardless of socioeconomics, our families, they all have mobile devices. And we're going to have to find a way to be able to figure out, both for the purposes of intervention and for the purposes of tracking and research, to be able to get bold and innovative in the use of technology for the purposes of being able to demonstrate the outcomes. Because in the end, back to what Joan was saying earlier, how do you eventually get everybody on board, Bubba on board, to agree to pay for? How do you do that? Well, you have to demonstrate the rate of return. You have to demonstrate, and which we all know in a whole lot of different examples, the rate of return on the investment is huge. I think that there's a lot of growth and there's some people doing some innovative stuff on the technology piece, is my opinion.
I think Tommy really raised a very important question. And first of all, thank you and congratulations to the whole Head Start community, for the wonderful, and the early childhood community at large, for a great victory in a very difficult climate. We're very excited about the early Head Start expansion. One of the things that I think is happening as we get better and better methodologies is we're developing programs that we kind of bring into programs, methods that we bring into programs, and I think we need to step back and ask the families. I had an experience with a Head Start director who said to me, we had this great parent involvement program planned, and we found that the parents weren't coming. And then we asked them what they needed. And it was totally different than what we were planning.
Yeah.
So I think we have to start with really listening to parents. I think that's to figure out how do we start, especially with families that are facing 5, 6 risk factors, and really some families that can't even get up in the morning. You have to really listen to them and think, how do we take them to the next step?
Susan, you wanted to add something.
Yeah, one of the organizations that we're working with in New York City works with a largely immigrant Chinese population, and a pretty large subset of that are really very limited English speakers. And I think going back to it's not like an either or. You're not either nothing or you're on a track to college. And there's ways even to think about the elementary school and what you might do with a family. So one of the things that emerged for them is, well, they wanted to be able to talk to the schools. And there were language barriers and confidence issues related to that. So there's ways of kind of getting them ready for the larger world, also that relates really directly to their kids and their kids' performance in school and building their own confidence. So it may not yet be that they're on the community college or 4-year college track. There's things that can be done that help them immediately and do relate to their own empowerment with the school system.
I was just going
to say, a colleague, many of the people in this room probably know Neil Halfin at UCLA, likes to say that every system is perfectly designed for the outcomes that it's producing. So if you want to change the outcomes, change the system. So I think the point that Mary was talking about sort of the collective impact way of thinking is to be beginning to think, how do we think about sort of the outcomes at a system level rather than an individual program or agency level? And if then the impact we're trying to get is to make a family successful, right? And we can define it so that everybody can say, okay, how are we going to measure that? And now what does each of us need to do in order to help achieve that result for families? Then I think you can begin to kind of create an environment in which a lot of the innovation and changes of ways of working together will happen. And realistically, given the federal budget situation, I think really the onus is at the local community level to figure that out. And to say the resources are going to be more scarce, even when we get, sort of these victories with early Head Start money expanding. But as an aggregate, the resources aren't going to be expanding. So we've got to be able to figure out which families do we really want to help focus, and hopefully those will be families with very young children, and to get folks to understand the benefits of putting their efforts together to focus at the family level for those families that have very young children.
To just really, Stephen, I wanted to ask you, the question you just asked about meeting families where they are and increasing families in deep poverty. And when we've had discussions, you talked about in your program, there's a certain sort of level of education and motivation that the program tends to work for, and that the next challenge for you is to try to find programs or how to design them for some of those families with, illiteracy or very low levels of education. Can you talk just a little bit about that?
Yeah, I mean, we're when we started, and the Ray Marshall Center out on the outside has a copy of the implementation study that's done, because really the work that we're doing in Career Advance, which HHS funded with a Health Profession Opportunities grant, a large expansion of it, we're really we don't think we have the answer. We think that what we're trying to do is really figure out what kinds of things we need to be doing differently and making continuous process improvements and adjustments along the way as we hear from families what is working and not working. And what we saw as we talked to our community college partners was that basically what they said is, look, we're happy to work with you to help. When we started, we were focusing just on the nursing track as the first track that we focused on. And they said, and in order for adults to go into the courses that are going to allow them to get their CNA and then their LPN and their RN, here's the requisite minimum skill level they need to do community college level work. Well, what we didn't really want to impose a test and a criteria, an entry-level criteria on our parents. We're having people sign up and come forward and say, I want to improve my situation, and then we tell them, sorry, but you're just, you don't meet the minimum thresholds, right? I mean, but the reality is that when we looked at what their entering skill levels were, many were so far below what the community college system said was required that we weren't going to be making them successful in the program, and then we weren't going to make our community college partners happy because they'd be spending a lot of effort on folks that weren't able to be successful. So we had to utterly redesign what was essentially a developmental ed program, recognizing that the vast majority of the parents of our children were at a level, particularly in their math, which was so far below what was required for community college entry that it was several, frankly, years away before they could really be strong candidates for entering the community college.
The same thing happened when we started CDA. We had to really deal with basic skills for the people that were going to be working with children. So you've got to recognize where people are, and those essential skills have to be the precursor to the work.
Yeah.
I'm Linda Randolph, Development Family Center. Thank you for the shout out. Is that Lee over there?
Yeah, it is.
I just have to have a comment here since my community partner is here, Kelly McShane from Community of Hope, because they run our out-of-hospital birth center in the District of Columbia, the only one. So I'm making a pitch for our philosophy, which is getting women early, meaning that you involve the whole system change effort around the birth experience. Because in fact, if you change that birth experience, we believe, and we have some data that would demonstrate that it is a significant emotional event in the evolution of families, and you have an opportunity to impact the families around that point in time, which is a missed opportunity for the majority of the families in this country. And so with nurse midwives, nurse practitioners, et cetera, we think that that dynamic can change. I'm a pediatrician, but I'm on that side of the aisle relative to that opportunity being a missed opportunity. There will be detractors, there's entrenchment, et cetera, but we think over the last 50 years, a lot of inroads have been made around that evolution of birth centers and involving the family. You want to involve the families, you get the families involved at birth, you have them for the life of the family. And just an aside, when we're talking about impact, panoramic vision for integrated service delivery is something that I would hope that we would be able to get funders to understand, whether they're government or philanthropic, to support those initiatives at the local level. If the systems aren't going to do it, the local levels will do it, and we will challenge the systems to ultimately do it.
All right, we have time for one more question, and I'm so sorry, I didn't see you there with the microphone, so you're on.
That's okay, the timing was good. I'm Margaret Holbert, I'm from the United Way of Greater Cincinnati, and we actually are a local provider, very committed to early childhood, particularly home visiting and quality child care. And I need to echo your sentiment that what we're learning in home visiting about not, Joan, you said it so well, not telling the mother to get involved in the program, but helping the mother engage with their child is huge. And so for someone who does, for an organization who does workforce and early childhood, I want to thank Ascend, because this is such an optimistic place to be. I mean, this is where the work is going to come together for those of us on the local level. My question, though, for the panelists is, we've talked about early childhood, and clearly important. Has anybody looked at, we're trying to engage grade school and junior high students in an excitement for their future and their future in work, and where that intersection is with their parents. And is anybody doing work around that?
Getting them in high school excited about parenting, planful of their parenting.
About their opportunities in work. So when they're in grade school and high school, talking to them about what their future could be and where that might intersect with their parents' excitement about what could happen for the parent themselves.
And they're reinforcing of each other.
Yes, they're reinforcing each other. Because I get the early childhood piece very uniquely. I mean, that's so clear and crystal. Has anybody done work at that older level of child, I guess?
For career purposes?
For engaging the parent and the child. You're talking about early Head Start is so clear, home visiting is so clear, where you engage the parent early, but we've got a lot of parents who've missed that opportunity. What happens? Is anyone engaging them around their young children's education?
Well, I think that's why we have to have an education reform that includes family engagement, you know, as a central part of the movement forward in education. And we have not had enough dialogue around that.
Okay. Anne?
Thank you, great comment. While I'm doing that, any just quick soundbite with our savvy panel here, last words that you want like to say as we get ready to close it out? I have a couple comments, but Susan, start with you and end with Rick.
No, again, I just want to thank Ascend and Aspen for bringing this together, for really bringing focus to this particular topic, and moving forward and looking forward to the next generation of work that in this national dialogue, and Lord willing, we'll come back maybe next year and be able to look back at some point at this time and what we've done to move the ball downfield as it applies to serving more families and children.
Well, you know, coming here, I think I'm in a 4-generation family. My mother's 91, my grandson's 3. And, you know, I think of him and his campus child care program that is so essential to his family and to our well-being. And I just feel like this agenda gives us hope of how we can move the inequality issue forward, and how we can embed a hope for education in our young children. So I'm very optimistic, but I think we have to keep pushing very hard so that the resources are there to underpin it.
I guess I would add that I think that sort of the models that we have right now are ones that we need to be testing, but then really continuing to innovate from. I mean, the way I think about it, the smartphones that we're all carrying around look very different a decade ago because of the rapid process of innovation that happens. And so the models that I think we're talking about and discussing today are good, but we really need to figure out how to capture and share the learnings from them, the insights, and to continue to develop the next generation of models.
I think we're at a unique moment because different types of people and organizations are working together around this, and there's an energy around this that I haven't been in this issue for that long, so I can't say I have never seen it before, but as I talk to people who have been, and you have brain scientists, and you have workforce people, and you have the early child care movement and home visitors, I think it's a moment that we don't want to lose, and we should really seize upon it. And I appreciate the work that Ascend is doing in this and inviting us.
Thank you. Thank you, everybody. Before we do a kind of a closeout sort of round of applause, because there's an amazing group of people in this room, so I want to make sure we have some time to informally visit for a little bit, but I wanted to close out with a couple of observations and thoughts, and then also some next steps. Just we try to be really transparent. I think one of the things I shared with Joan, like, we're not getting younger, but we're getting more impatient as I'm trying to be patient with my children. But there's a piece that there's the only thing that becomes more reinforced having had worked at the ground level, the policy level, and the philanthropic level. If there only was one answer. I mean, I think at the heart of the two-generation approach, there is, yes, the boldness, boldness, the strength, but there's also a profound humility. And so I think when we're talking about connecting, it's both humility as if only one organization or one strategy could do it all. And so I just always feel it's really important to reinforce, because I think it calls a lot of us to really reflect internally and externally about what's it going to take. And a lot of times we talk a lot about funding, and when Ascend actually got created 3+ years ago, there was a lot of national conversation, understandably focused about funding. And that's important, and we always want more money. Feel free to get involved and give. But it's what we do with our money, and it's what we do with our time. And so one of the things that, why we are at the Aspen Institute is Walter Isaacson is someone who always charges everybody here at the Aspen Institute to think big, to be bold, and to engage in authentic dialogue and stay focused on the solutions. And so for us, I actually think one of the biggest questions, and this is one solution, one way to think about it, is we have disconnected the conversation about our values and our economy. And so even when we think about what that happens downstream, it can push you into the camp. We've talked about silos of strategy. We haven't talked about the siloed nature of how we look at human beings. You have, as a past funder, you have kids over here, you have the women and girls group, you have the men of color and boys of color, you have all these different constituency strategies, and they're all really important. It's really understandable why they're there. For us, at least in our humble way, we're trying to be a platform for where can that come together in service of moving families forward. So I always want to be really sort of philosophical, but also really concrete about sort of both the challenges and the opportunities, that bringing children and parents together is a powerful opportunity. And one of the most intriguing moments I thought in the State of the Union was when the president talked about family and medical leave. And he first said, so a mom can stay home, applause, a lot of clapping. And then it sort of happened, and there was a little bit of a break in the rhythm, and he said, and dads too. That is actually a sea change opportunity, because this is about mothers and fathers. The structure is changing. What families are going to look like it's already radically changing in terms of the spike of single parents. I'm not in the business of labeling, but I think we have to figure out how we're connecting parents and families, and you start where they are. So the second point is when you start where families are, absolutely. More importantly, or equally important, you also engage with them on where they want to go. Because it's very important when we talk a lot about mutual motivation and we talk about assets, we have to talk about aspiration. We haven't been at the ground level, and people like Stephen, and Joan's out there with everybody, and Susan too, and Rick. But when you're actually talking to a parent, they're they are wanting to do their best so their children can be their best. There was a mother in Richmond, and she had lost her home. She was trying to do a couple of minimum wage jobs, keep her kid in school. And she was also going to the community college and trying to work on her GED. She finally got her GED and put it up on her refrigerator so that her children would see her educational success. And then she was continuing with the community college because she wanted to be able to help her kids with homework, let alone get a good job. So I'm just sort of saying, I get where we have to go where people are, but I want to also play to their aspirations, because they're just like all of ours. Lastly, on next steps, just so we have you in the room, as a national hub, we have we had an inaugural national fellowship program, of which Stephen Dow was one of our fabulous fellows. I don't think we have anybody else in the room. But what we tried to do as a national hub was look at where there were 20 exceptional leaders. Some, like Stephen, we just are, he is really a pioneer about thinking about these questions, as well as Rick. We'll have another class. But thinking about children and parents together. But there were community college leaders that said the higher ed student population right now is 25% their parents, and 13% are single parents. Like, it's a different world. We have people that are looking at early childhood. So we're trying to look at that through our fellowship strategy, as well as some of you may know, we put out an Ascend Fund. Again, we're not a foundation, but we felt really strongly that as a national hub, how were we authentically working with the field? So we looked for where were there promising practice, policy, evidence-building efforts, political will efforts for people that thought that the two-generation approach could help them have better outcomes. And so this whole collective impact is kind of our DNA. And for us, is how do you think through where are going to be the strands, what is this going to add up to, both in terms of the challenges and opportunities. And one of the things that struck us, we had about 254 letters of inquiry for this from 39 states, from Cook Inlet, Alaska, to the Delta and Mississippi and Alabama, the Washington, it covered. And what it said was not only, again, people are going to apply for funding, but people are very hungry to be part of the solution. And there are also solutions happening there. And so, as we go forward, there is a lot of learnings as we're sort of looking through that, because we're going to be creating a national learning network around the two-generation approach, not trying to be everything to everybody. But we'll have a lot of lessons and learning coming out of that, a lot of ongoing work building on the work of this very important report. And for those that are living, I want to just put this out for the folks in the Washington metropolitan area. Everybody knows I have a love for our local area. But Washington and Colorado are homes to the Aspen Institute. So anybody, especially from those two states, well, 3 states here, Washington metropolitan area. I want to say, because it's not just what we're able to fund, it's going to be really what we're able to do. We talk a lot about where are we sort of leading, where are we partnering, or where are we supporting. And there's a lot of great stuff here happening in the Washington metropolitan area. So I will close with, before I say the thank you, one of my heroes, Madeleine Albright, who chairs our program committee. When we were just getting started, she said, well, I love this. And the reason why I love it, she's not, sort of domestic strategy woman. She said, I love it because you have 2 political constituencies already. You have kids and you have adults. And she said, never start with one constituency. And she said, get going. So she had a lot of other things to say. But with that said, the Aspen Institute is excited to partner here. We are deeply grateful for this panel, and not only for your remarks, but also for the work that you're doing. So Bridget Schulte, thank you for your work at the Washington Post.
Really?
Rick Noriega for your work at Avance, Joan Labardi for the world and the local community and everybody in between, Stephen Dow, Cap Tulsa, and all that you're sharing with everybody as you bring them to Cap Tulsa and you share so generously, and Susan Gewirtz for all the good work you're going to do and keep funding later. Thank you, everybody.